Medical tourism in Panama can make sense, but only when you verify the provider, the full cost, the recovery plan, and the risks.
This Panama Healthcare series shows you how to plan for care, from insurance and emergencies to hospitals, pharmacies, and chronic conditions.
Welcome, my friends. So, did you know that saving $4,000 on a surgery abroad could actually end up costing you more if you don't properly plan the logistics? Look, it is absolutely true. I am so glad you're here today for this explainer. Think of me as your older, wiser, local project manager for healthcare right here in Panama. Today, we're going to look very closely at a topic that gets a massive amount of hype, but frankly, it needs a whole lot more practical planning. We're breaking down the absolute ground-level realities of medical tourism in Panama as we look toward 2026.
Right off the bat, we've got to clear the air. There's this persistent myth out there, the discount vacation. You know the one. It's the idea that you can enjoy a margarita on the beach for the side of complex dental work or elective surgery. Listen to me, medical tourism in Panama is highly practical, yes, but it should never ever be treated like you're just booking a cheap weekend getaway. The reality is that evaluating treatment abroad has to be handled as a serious, risk-managed healthcare project. You have to confirm the diagnosis, verify the provider, plan your recovery, and know exactly what happens if something goes sideways. That is how we protect you.
Here is our roadmap for the project. 1. The reality of medical tourism. 2. Vetting doctors and facilities. 3. Calculating your true costs. 4. Stem cells and legalities. 5. Building a complete healthcare plan. And 6. Your next steps.
Section 1. The reality of medical tourism and why Panama matters today.
As we look ahead to 2026, you've got to understand that Panama's strongest medical tourism case isn't just that things are cheap. No, it's that Panama City has built a very deep, highly concentrated network of world-class private hospitals. We are talking about modern, heavily invested institutions, places like Pacífica Salud, Hospital Nacional, the Panama Clinic, Hospiten Paitilla, and Hospital Santa Fe. Because these state-of-the-art facilities are clustered so tightly together, along with their specialist networks, diagnostic centers, and high-tech labs, planned care is highly accessible. It's just so much easier to organize a complex procedure here where you have all the necessary specialists in one single neighborhood, compared to a lot of smaller international destinations that just lack this kind of modern infrastructure.
But lower cost does not automatically mean lower risk, right? The CDC explicitly warns us that medical tourism can carry risks that must be planned around. Now, genuine savings absolutely exist, especially for things where you pay directly out of pocket, like extensive dental work, elective cosmetic procedures, vision care, and complex diagnostics. But traveling for care adds real layers of complexity. We are talking about potential infections, communication challenges if you don't speak Spanish, and massive gaps in continuity of care when you board that 6-hour flight back home. Let me tell you from experience, sitting in a cramped coach seat with fresh surgical stitches is nobody's idea of a good time. Those savings only matter if you aggressively protect your safety first.
Section 2. Vetting doctors and facilities. The rule here is trust but verify.
You absolutely must verify who is actually holding the scalpel. Please, whatever you do, do not rely on a doctor simply being highly recommended by a friend. Step 1 is to verify their specialty training and check their actual medical license. Step 2 is incredibly crucial. You need to confirm their hospital privileges. Look, a clinic-only procedure might be perfectly fine for something minor like a standard checkup, but for surgery, your doctor must be connected to a major facility with fully equipped operating rooms, intensive care units, and rapid emergency support just in case things take an unexpected turn. Step 3 is checking their authorizations. Look for local compliance through the Ministry of Health. We call it MINSA down here. Even better, look for international accreditations like T-MOS, which the Panama Clinic holds, or the Joint Commission International. These accreditations mean the facility adheres to rigorous global safety protocols. The systems matter just as much as the individual doctors.
Section 3. Calculating your true costs. We're looking for arbitrage, but without the blindness.
So let's talk about arbitrage. It simply means taking advantage of price differences between two places. The danger here, though, is cost blindness. When you get a medical quote, the procedure price always looks fantastic. But the total trip cost, that is a completely different story. Listen, saving $4,000 on a surgery means absolutely nothing if you end up spending $2,500 on last-minute flights, extended stays in recovery hotels, expensive local transport, and lost income from missing weeks of work. Not to mention your companion's expenses. Believe me, those room service bills add up fast.
The medical quote is literally just one single part of your overall project budget. So you really need to break down your realistic budget logically. Before you ever set foot on an airplane, demand a written, itemized estimate. This estimate must separate professional fees, hospital fees, anesthesia costs, and lab work. Then, you add in your travel and recovery logistics. And the final piece of the puzzle, the one almost everyone forgets, is potential complications. Complications can erase all your savings in an instant. You need to check if your travel health insurance actually covers complications from elective procedures, or if it will pay for a medical evacuation. A true medical evacuation flight can cost tens of thousands of dollars. Bottom line, if a provider will not give you a detailed written estimate of what is included and what is excluded in their price, you must pause the project immediately. Section 4. Stem cells and legalities. We need careful questions here, not marketing hype.
Now, stem cell claims require extreme, rigorous caution. There are massive red flags you must watch out for. Guaranteed outcomes, high-pressure limited-time discounts, vague medical credentials, no written estimates, and absolutely no proper consent review. Please, I beg you, never travel for a major medical procedure based solely on a beautiful website or a casual WhatsApp reply from a sales rep. Marketing teams can run far, far ahead of actual medical evidence. A slick professional website cannot prove lab standards, and it certainly does not guarantee ethics oversight. You have to dig deeper.
Look at the FDA. They explicitly warn that unapproved regenerative medicine products can expose patients to serious risks. We are talking about blindness, tumors, and life-threatening infections. You must separate commercial claims from strictly regulated clinical use. I highly recommend using verified resources like the International Society for Stem Cell Research Patient Handbook to help you ask the right, tough questions. And always seek independent medical advice before paying out of pocket for experimental therapies. In fact, in Panama City, you can even use established pathways like the Mayo Clinic's representative office right here in town. Use them to get a proper, unbiased second opinion from a world-renowned institution before you commit to a single thing. Another vital part of this project phase is understanding your legal protections. The malpractice processes, the complaint channels, and patient legal rights in Panama are very different from those in the US or Europe. Handshake agreements or verbal promises, they simply do not hold up here. Your primary safety net is thorough documentation. Arrange professional translation for your Spanish medical documents. Actually, let me be clear, do not rely on rough summaries from a bilingual friend. Keep secure digital and physical copies of all emails, invoices, and signed written consent forms. For medically complex or high-cost procedures, strongly consider consulting a local patient advocate or a Panamanian attorney to review your contracts, because protecting your legal standing is protecting your health.
Section 5. Building a complete healthcare plan, looking way beyond just the procedure itself.
So, medical tourism is usually laser-focused on a single isolated procedure. But if you are an expat living here or you're planning to spend significant time in Panama, you need a sustainable, everyday health routine that goes far beyond one surgery. I strongly encourage you to explore the other essential guides from our source material to build that foundation. Blog 5 covers the elite network of private hospitals, explaining exactly how these Tier 1 facilities interlock. Blog 2 breaks down the insurance matrix so you can perfectly understand the difference between temporary travel policies and permanent resident coverage. And Blog 7 covers Expat WellCare, which shows you exactly how to navigate local pharmacies, manage chronic illnesses, and maintain a strong preventative health routine once the stress of your surgery is finally over.
Section 6. Your next steps. Because preparation is protection.
I want to leave you with this somewhat provocative thought. Have you planned for what happens if your recovery doesn't go smoothly? Let me tell you from years of seeing how this works. Waking up alone in a strange hotel room, feeling absolutely terrible after anesthesia, is not a brave solo adventure. It is a terrible, dangerous backup plan. You need a solid companion plan. You need reliable transport to your follow-up appointments, and you need a designated emergency hospital, like Hospital Santa Fe, which advertises 24/7 emergency service, ready to go just in case.
Do the due diligence, my friends. Treat your healthcare like the vital, complex project it is, and you will do great. Panama is a beautiful country with incredible medical talent, provided you plan correctly. Be sure to read the full source guide on safety and costs to get every single detail we've discussed today. And make sure to watch our next explainer to fully master your Panama healthcare plan. You've got this. Until next time, plan smart and stay healthy.
Join IGO Panama, the largest community for tourists and expats in Panama, and get free access to trusted resources, our private Facebook group, and our verified directory.
This 8-part Panama healthcare series helps expats plan for care, from insurance and emergencies to hospitals, pharmacies, chronic conditions, and what to avoid before you need care.
If you found this helpful, explore more on IGO Panama. Visit and join www.igopanama.com/join.